Story 1. I do not use the injections, but I use the topical cream. The biggest benefits that I see are 1. Recovery from injury. 2. Increased energy. Before I started, I felt like I was continuously coming down with the flu. Story 2. 63 just started. I do not feel different. However, I am making progress in the gym again. My body composition is improving, and I am experiencing morning erections more often. My hormone levels increased from the low 200s to the mid 700s. I had a rise in estradiol, so I am also taking an aromatase inhibitor. Edit. Twice per week, 0.3 milliliters each time. Story 3. I am only 39 years old. My test result was 208 in October, and in January my laboratory results showed over 1100. In June, my laboratory results were approximately 1050. I feel like a new man, but it took time. Story 4. I am 49 years old and have been on the injections for about 2.5 years. It has been seriously life-changing. I quickly got into the best shape of my life. However, it is important to understand that to truly get the benefits, you need to manage your diet, sleep, and stress effectively. In terms of how I feel, it is basically about regaining all your motivation and drive. Story 5. You are not going to get a high like you just took a line of cocaine off a stripper's chest. I am 52 years old and have been on it for 5 years. I go to the gym 4 days a week and run about 6 miles a week. 2 years ago, I had to stop for 6 months because I had a high prostate-specific antigen. I had to force myself to go to the gym 2 months into being off it. It was difficult. As for erectile dysfunction, which I have, there was no improvement. As for sex drive, it increased significantly. It is a game changer for me. Story 6. I started testosterone replacement therapy at age 46 after trying for a year to raise it naturally. It definitely woke me up to what I had been missing. I slept better, temper tantrums and angry outbursts pretty much disappeared. I also improved my emotional intelligence. Overall mood improved, I became a better husband, and gym recovery and performance felt like I was 25 to 30 years old. It has definitely been a game changer for me. It takes about 3 to 12 months to really feel significant changes and should coincide with lifestyle changes and choices. If you are already lazy, overweight, and immature, it is probably not going to magically change you. Story 7. Life-changing for me. I started with 2 shots per week about a year ago and would never go back. Besides, my wife would be very upset if I stopped. My sex life is better than when I was 30. I have increased strength, sleep better, improved body shape, and am more focused. I wish I had started when I was 50. Story 8. I am 50 years old. I have been taking a low dose of 20 milligrams every other day for just over a year. The change was slow, but because my levels were very low at 6 nanograms per deciliter, returning to normal levels improved my mood significantly. Story 9. I was on testosterone replacement therapy for almost 10 years. I am 48 now. All my joints hurt less on it. Effort at the gym feels better on it. I only quit when my blood pressure got out of control, and I did not want to take medication for that as well. Also, I became really tired of injecting myself twice a week. It was tedious. Coming off is no fun either. It took many months for those raisin-sized testicles to bounce back. I miss having tiny testicles. They do not get in the way. They never got sweaty. Testicles are overrated. Really? Story 10. I have a couple of friends who swear by it. I will pass for now. The bad thing about it is that once you are on it, you have to stay on it forever. Story 11. Another question for those taking it. Is insurance covering it, or are you paying out of pocket? How much are you paying? Story 12. I am in my mid-30s. I had extremely low testosterone, almost none. After a year on human chorionic gonadotropin, my last check was around 1200, which is very high. Being on human chorionic gonadotropin has made me a completely different man. I feel more like a man. I have more energy. I have lost weight. My sex drive is higher, and my wife finds me very attractive. Story 13. 45, not hugely different, but I can definitely tell if I have not taken one in a couple of weeks when I am out or forget. I get lethargic, foggy, and feel terrible. Story 14. The only time I took it was when I was 32. My levels were in the 160s. To be honest, it was a nightmare. Yes, I lost 30 pounds in about 3 weeks. I went from 6 feet 2 inches and 260 pounds to 230 pounds in a short amount of time. Honestly, I did not feel like I slept for more than 3 hours on any given night for about 2 months. The first 2 to 3 weeks were bad. My eyes were like they were open at all times. Personally, I needed the injections. I think they were spaced out every 2 weeks and I had a total of 4 shots. Story 15. I had been using pellets for about 10 years. My testosterone had dropped to around 0, a condition called hypogonadism with no obvious cause. My energy had tanked, I wasn't sleeping, and I was putting on weight. The pellets took a bit to kick in. I got them every 4 months but was then able to keep up with people in their 20s when I was in my late 40s. I also moved to high-intensity interval training 3 times a week. I was working at a startup at the time, usually 60-plus hours a week, plus managing a busy family life with kids in elementary and middle school. I even fit in coaching little leagues somehow. I feel best closer to a testosterone level of 1,000. My doctor lowered it to the 700s for some reason about a year ago. I lost energy and libido and asked to go back up, but he said no. I found a new doctor who started me on the roll-on gel. Now I'm back at 1,000. Libido and energy are restored. I feel great again. I did injectable testosterone during COVID-19. I don't recall feeling any different with that compared to the pellets. It was more convenient, as I could do telemedicine and not have to go get the pellets inserted into my hip. Your mileage may vary. I tried other treatments under medical supervision to increase energy, and the only thing I can swear by is testosterone. I know others have different results. Sermorelin, in particular, had no noticeable impact on me, but I know others rave about it. Story 16. I have been on testosterone replacement therapy for 20 years now, since my mid-20s, because my body decided that I no longer needed to produce testosterone naturally. I produce a level of about 70 naturally, so testosterone replacement therapy is the difference between misery and comfort daily. I take an injection weekly, and my levels go from about 1,100 to about 200 weekly. 2 days before injection time, I start feeling tired, retain water, and my shoulders get tighter and begin to ache. On the night of my injection, all of that worsens, plus I tend to have a massive headache at the back of my skull. I take my injection and wake up the next morning feeling about the same as the day before the shot. From days 2 to 6, I feel human. Story 17. I'm on 200 units a week. Testosterone cypionate. I just moved to subcutaneous injections versus intramuscular. My arms were constantly sore, so my doctor switched me to subcutaneous for a while. I changed from 1 shot of 200 units to 2 shots of 100 units each on a 4-day rotation. My shoulders, upper chest, and back are XXL in size, but my waist is a large. I'm still competitive. I'm the older man in the gym, outlifting most of the 20 and 30-year-olds. In my 50s, on Monday, which is International Chest Day, my heavy workload was 245 pounds for 4 sets of 5 reps, 155 pounds for 2 sets of 12, 205 pounds for 2 sets of 8, 245 pounds for 4 sets of 5, and then 185 pounds for 1 set of 12. How do I feel? I'm ready to head down to the villages, kissing lips and breaking hips. A side note, when my doctor showed me how to give myself the injection, I asked about using the quadriceps or hamstrings, and I quote, "No, that hurts. Don't do that. You don't have any fat tissue on the quadriceps." I asked about the inside of the hamstring, and he said, "What did I just tell you? The cool part is we belong to the same gym." Story 18. Out of everything I have taken for health, it has been by far the most beneficial. It has improved my mood, energy, muscle building, and helped me finally lose weight. Story 19. I have been on it for 23 years. Better energy, better libido, better muscle mass with exercise. The other men in my family went bald by age 60. My hair has not even fully turned gray. Story 20. I am a 63-year-old who has been using testosterone replacement therapy for 10 years. I use compounding cream, which I can get without insurance for about $45 a month. I take a 1 milligram dose morning and night. My testosterone level was below 100 nanograms per deciliter. My doctor theorized that I had damaged my testicles at some point to be that low. Currently, my levels hover between 300 and 500 nanograms per deciliter. The difference is vast and life-changing. 1. My food intake was strict, and I worked out with a trainer for a year with minimal results. The trainer suggested I get tested. Within 6 months, with the exact same fitness and diet, I dropped 20 pounds, but more importantly, I actually gained muscle for the first time in a long time and have maintained it to this day. My mood improved dramatically. Before, I had to push myself to keep moving and get motivated. Now, it feels like I am young again and find motivation effortless. I was no longer lethargic. Daily activities flowed normally. My blood sugar A1C dropped from 7.4% to 5.8% with the same diet and exercise. I was able to work a full 8-hour day. Before then, I would get worn out after 5 to 6 hours. Story 21. Oh my God, it's wonderful. Married 35 years and almost need daily release, and I am 67. Seriously, my libido is reborn. Story 22. I use injections, starting when I was 34. The most notable change for me was less painful joints and my tendinitis healing significantly. I lift a lot and had been monitoring my diet for a few years, so my doctor was confident my low testosterone was not caused by an unhealthy lifestyle. The injections made me feel much better and not like my body was falling apart after a tough lifting or running session. Sex drive went through the roof too, but it was not very low to begin with. I did not have a lot of other changes, but I kept my injections low and only increased them very slowly with doctor supervision. Story 23. I started at 57 milligrams and took it for 4 months at a low dose, increasing from 300 to 900 milligrams rather quickly. For me, I became hypervigilant and too aggressive and irritable, so I reduced the dose. To be fair, I am a veteran with trauma, and it did not work well for me. Your mileage may vary. Story 24. Elevated mood, increased energy, improved sleep and digestion. Effort feels rewarding, motivated to tackle challenging tasks. I get blood work every few months, aiming to optimize health rather than settle for average. Story 25. 44 here. Libido is better and energy levels in general are higher. Testosterone affects many things, such as the ability to lose weight more easily. Story 26. I started testosterone at 47. It makes me feel 15 years younger. I have more energy, libido, and drive. I am working out more and getting in better shape. My 40s were brutal, and as I approach 50, I plan to make it the best years of my life. I am pretty responsive to testosterone. A dose of 120 milligrams puts my total testosterone above 1,000 nanograms per deciliter, and free testosterone runs very high. I have reduced it to 80 milligrams to see if it stays in the 600 to 700 range, which feels easier on my body. Story 27. Was on undecanoate gel test plus other treatments from age 23 to 31 years. The worst side effect was severe anxiety, not caused by the test. Otherwise, I felt no different. From age 31 to the present, prescribed 350 milligrams per week testosterone cypionate, which peaks my levels at 1,500 nanograms per deciliter. I feel the same now as I did before. Story 28. I am 44 years old and have been on treatment for 4 years now. My libido is very healthy, and my energy has returned. My sleep has improved significantly, and my gym performance is back. I have regained confidence in many aspects. The opposite was true before I started treatment. I never thought about sex and was ready to go to bed at 6 p.m. I never felt like I got enough sleep. I look and feel better than many people my age, although my hairline is thinning. Story 29. I contributed Lexapro to decreasing my drive. I started testosterone replacement therapy and immediately started chasing my wife around the house with a strong erection. I am exaggerating a bit, but I have more energy and my sex drive is back to normal or maybe even higher. I feel great. I am not sure how much of that is entirely from the testosterone replacement therapy because I have also made other life changes. Story 30. I take mine orally. It took a while for me to notice a difference, but what really worked was starting estrogen blockers. Apparently, some people overproduce estrogen when their testosterone levels are increased. Story 31. I am 35 years old. I took testosterone replacement therapy for 1 year. I was taking 120 milligrams per week, divided into 3 injections of 40 milligrams each. What was unusual for me is that I did not feel a significant difference. I did experience testicular atrophy. However, I did not notice much of an increase in libido or energy levels. I still experienced erectile dysfunction. All the issues that testosterone replacement therapy is supposed to improve did not improve for me. I have been taking clomiphene citrate for 6 months to help my levels recover after stopping the injections. I have gained weight around my belly and have difficulty getting out of bed. I have had issues with testosterone on and off since I was 21. I do not know if it is stress or something else, but I am unsure about what to do anymore. I am getting another blood test tomorrow to check my levels. If they are not good, I will probably have to start taking testosterone replacement therapy again because I do not feel well. Story 32. I just started. I wouldn't be considered older, but I have been symptomatic of low testosterone for about 5 or 6 years. I basically felt like I had worked all day by 11 o'clock in the morning, even if I didn't do anything. I was never in the mood and had no energy at all. I got my numbers checked. On the surface, they just looked slightly low. That was until they did the liver test for sex hormone-binding globulin. This determines how much testosterone is being released into your body. With those numbers, my free testosterone level plummeted. I have been on treatment for about 10 weeks now, and I have seen a noticeable difference in my energy, muscle mass, and libido. I feel great. I am about 20 years away from my 60s, by the way. I feel like I am in my mid-20s again. Story 33. I have used the injections, the patch, androgel, and implanted capsules. The capsules actually ejected themselves. They were in my waistline and just came out a month after implantation. The patch made my skin look like a Japanese flag with one big red spot on my shoulder. The androgel gave me a rash all over my abdomen. The injections hurt severely until I started losing feeling in my thigh muscles. Ultimately, I did fine without any of them. Your partner makes a huge difference. Story 34. Started 4 years ago. More energy throughout the day, maintaining strength, muscle mass loss stopped, sleeping better. The worst side effect is a dramatic increase in libido. My wife is severely disabled. Red blood cell count rose too high, but this has caused me to donate blood regularly to keep levels normal. Story 35. I am a 55-year-old male. I have been giving myself injections for a little over a year now. I used to prefer the cream, then tried the pellets, and now I prefer the injections. There is no messy cream and no chance of my wife growing a mustache from accidental cross-contamination. Once you get used to injecting yourself with a large needle, it is not that bad. Took me about 6 months to get used to it. The injections stabilize my mood, somewhat improve my libido, and increase my stamina. Story 36. Do you remember what it was like when you were 35? That is how it feels with morning arousal. Story 37. I had extreme fatigue, which is what led me to the doctor. The treatment fixed the fatigue and also boosted my mental clarity. Story 38. Where are you going for this? My general practice doctor was not interested in even giving me a slight boost. I am 37 and just want to be able to recover for the hobby sports I play. Story 39. I'm still young but will definitely consider taking it in my older years. I don't see why you wouldn't. Story 40. 48. 2 injections of testosterone cypionate weekly. More energy. After work, I can actually do something instead of feeling exhausted. Libido is very high now. My ability to recover and grow from weight training is improved. I think it makes me a little more impulsive and compulsive. I crave alcohol and nicotine more than I ever have, which feels strange. When I'm frustrated, I'm really frustrated. It's 90% great and 10% things to be aware of and manage. Story 41. Where do men go to get this? My doctors refuse to test, saying there is no baseline level for an average male. Story 42. I have been using the gel for about 10 years. Without it, I feel low energy and lose my zest for life. With it, I am my true self. Try it. Story 43. The internal monologue stopped, which was a relief because he was an unpleasant person. Also, I am able to decide whether to validate emotions or not like a firewall. 10 out of 10. Would recommend. Story 44. I take testosterone. I notice that I am not as tired and have more vitality and energy. It took 30 to 45 days to feel the improvement. A blood test showed I had barely a trace of testosterone. I inject 0.5 milliliters intramuscularly in my thighs once a week. I am balanced now. Story 45. Your hair on your head falls out. Your blood pressure goes through the roof, and you get an incredible vein-popping pump. Story 46. I have been using it for years. I couldn't really notice much difference. I stopped for a couple of months, and the fatigue was unbearable. I miss my testicles, though. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.